Lars, your title is music therapy expert. Could you give us a brief history of music therapy and your work in the Nordic region?
Well, the history of music therapy goes all the way back to the dawning of our civilization. So it all started in ancient Greece, actually, with the theories of Plato about the influence of music on your mind and body. And if we think about the first medical center that actually existed there, the Epidauros, it was the whole idea about bringing together art, music, and all sorts of healing in the same ceremony. So the ideas go very long back. And there has been a more theoretical history all through the centuries, but I would say that empirical music therapy started after the Second World War in America. So it was really much related to the soldiers coming back from the war with a lot of wounds in their hearts and in their minds. They had what we call PhD today. So they were severely traumatized. And some doctors found out that music was almost the only thing that could help these soldiers. This is quite interesting because this success by treating these soldiers actually led to a lot of training programs coming up in the United States in the 50s and the 60s, and this spread all over the world. So we've had music therapy programs also in Europe since the late 1950s, and in the Nordic countries since the 70s and 80s. So we have a brief but very concentrated history, and luckily it has been a history of success, I would say. Music therapy in hospitals is a special chapter in the Nordic countries. So we have like two types of hospitals. We have the psychiatric hospitals and we have the somatic hospitals. And we even have centers of rehabilitations, and then we have palliative care units and hospices. So music therapy is not everywhere. It's in the psychiatric hospitals, both in Denmark and in the other Scandinavian countries, but it's not so much in the somatic hospitals yet in Denmark. It is in Norway and in Sweden, so there are cultural differences here. But in Denmark we are very strong on music therapy and psychiatry. So we have a long tradition and a lot of documentation about how music therapy works with patients who suffer from schizophrenia or bipolar disorders or personality disorders. They all benefit of working with music as a non-verbal language. Often they don't trust their own words, they don't trust the words of the doctors or the psychotherapists, but in music you're allowed to say anything, and you can communicate what's inside in a non-dangerous fashion. So this helps a lot. It takes a long time to work with psychiatric patients, but it's very, very rewarding. We are working these years to implement music therapy also in the somatic hospitals. Recently, music has entered the ambulances. This is very interesting because I think it's one of the most scary experiences you can have, to come into an ambulance and hear all the flipping sounds and all the strange noises and of course the sirens, etc. So we can mask all that with music. We can simply concentrate the patient's mind on soft sounds instead of all these scary sounds. And the whole idea is actually to take the music program that we have developed and let it last from the ambulance and all the way through the stay in the hospital until the patient is released and can go home, and they might even take the music with them. The concept we have here is called the Music Star, which is like a software program where you can choose between a lot of different music programs that really fits to your mood and to your needs here and now. They can be relaxing, or they can be more stimulating, or they can assist you when you have difficulties sleeping. So this is pure music medicine. I would say that music therapy and music medicine are two different paradigms, two ways of understanding how music can work on the patient's body and mind. When we talk about music medicine, it's more like a stimulus effect model. It's the music that does the work. When we push the button and some music is played, we hope that it has a significant effect on the patient, either on the heart rate, on the pulse, or on relaxation, or whatever that we can actually measure. If we talk about music medicine, we add a third component, namely the relationship between the patient, the therapist, and the music. This is a very dynamic way of understanding, more like a systems theory, that we do something together. And I think this is really a specialty in the Nordic countries, in our music therapy tradition, that we work a lot with the resources of the patients. We are not so much thinking about their pathology or their sufferings or whatever. We are really trying to find what they can do, what they believe in, and the way they want to use music to become better. I think that music therapy to people with chronic diseases can really make their life easier. It can give them some more quality of life, because music may assist them in alleviating their pain. We can really work with we cannot remove the pain, but we can make it more understandable, make it more like an integrated part of their everyday life. It won't go away, but you have to cope with it somehow, and music is a nice way to cope with enduring pain in chronic diseases. In music therapy, we have a lot of research on moments. We call them different things. We call them moments of hope, present moments, or even pivotal moments. A pivotal moment could be when you listen to music and you concentrate on your inner imagery, and then you suddenly realize that, oh, this creature, this specific image is telling me about how my life has been and where I should go from here. That's really very, very interesting, and it can be the moment of your life, the moment of change. We have a lot of experience with the music used in elderly homes and with people suffering from different forms of dementia. And the very interesting thing about music and dementia is that even if you have lost most of your memory, even if you have lost your language, when music is played, when you sing music, when you dance, etc., your body remembers. So there's a long time memory left for music, even with the words. So for the relatives, it's fantastic to see their demented father or mother coming to life. We can see it in their eyes, and they might even sing songs from their childhood, even if they are not able to speak. It's very, very moving, and it's about coming to life, I would say. So music can bring people to life for shorter or longer time, and the new project that we're working with is really a project where we want to train the staff in these homes to use music more. It's not about bringing a lot of music therapists into the homes. It's about using music in the everyday life with the staff that's there, so that the patients can benefit from all the power of music.